Welcome to our 12 noon bite-sized booth talk about how Arcadia and HealthHelper are collaborating to help practices better perform in value-based care, to ease the experience of care for providers across the healthcare system, and to use technology, AI, and patient engagement technology to deliver a better consumer healthcare experience. I'm Michael Meucci, the President and CEO of Arcadia, helped start the business 15 years ago, joined by Josh, who I'll let do a quick intro.
Yeah, I'm Josh Kahane. I'm a family doc and CEO and co-founder at HealthHelper. We're helping provider organizations with patient engagement, scheduling, and care navigation.
So as we dive in, I want to kind of frame the challenge that we all exist in today. The pressure on the U.S. healthcare system is immense, and one of the great things that I'm excited about as an entrepreneur about the current situation in U.S. healthcare is that pressure drives transformative outcomes and it drives beautiful things. Everyone has to remember that diamonds are created under pressure, and I think that that's the opportunity we have in front of us right now, is to create spectacular healthcare outcomes. And the pressure on the labor force, on clinician shortages, specialist shortages, is driving and accelerating and forcing innovation. As we partner with HealthHelper, we have an observation that across the country, payers and providers are re-examining the risk balance that exists in their contracts. Payers want to shift more risk for performance onto providers. Providers are trying to stay afloat and stay alive when there's physician shortages, extender shortages, rising wages, and a number of cost pressures on their businesses. And ultimately, making this shift to value can provide significant upside for providers, but it requires investing. And investing requires capital and resources, and those are not in abundant supply today. As we partnered with HealthHelper, we wanted to create a partnership that allowed us to help providers navigate this chasm and close the gap and the dissonance that exists between providers who are payers who are trying to shift risk to providers, and to providers who want to lean in and provide high-quality, value-based care to their communities. The challenges that we're going to cover today is how do you work together with payers, providers, and technology vendors to build a more proactive health system focused on preventive care, to accelerate incentives in value-based contracts, and to provide a leading consumer-focused experience for patients and practices, and how technology and people are working together to solve those problems.
Awesome, Michael. I share that same sentiment that you discussed there. A lot of provider organizations, while moving to value-based care, are still stuck in a lot of fee-for-service behaviors and reliance in dollars. And so at HealthHelper, we really developed this from my experience as a practicing doc, which was I was seeing my patients every day, but getting these chase lists about folks that I needed to engage around different healthcare services to help perform in those value-based care contracts. And what I found was that as a provider and my skeleton crew, we didn't have the time, skills, or resources to really do this adequately. And even the efforts we did make were not convenient for patients. And so we had to come up with other ways to engage patients that were not resource heavy, but were very effective. And so we've automated that using AI and some services to wrap around to really help drive the outcomes, which are scheduled appointments for closing these care gaps to help drive that performance, and do it in a way where we can really leverage the great data that Arcadia is able to provide so that we can prioritize and get all those things done to drive that performance for those organizations. And as we've highlighted here, those contracts are getting more and more complex, and average providers have somewhere between 16 and 20 different contracts that they're trying to wrap their heads around. That's on top of seeing their 20 to 30 patients a day. They really need help in this area.
I think the thing that's also so relevant is we talk about contracts and we talk about incentives, but this really is about the patient and how do you deliver the care the patient needs. We were talking a few minutes ago, we're both pretty lucky, we're healthy, I'm going to say young, not middle-aged, just quite yet.
Yeah, I'm with you.
Guys, and like most of our healthcare is limited to a 20-minute encounter once a year. And so when you think about all of the different healthcare interactions that can happen between those annual wellness visits, where are we seeking care? It's oftentimes not our PCP's office. It's a minute clinic or a pop-up vaccine clinic, sometimes a workplace vaccine clinic. And what we're trying to focus on is how do you build the affinity between a patient and the provider office. Absolutely. And take cues from consumer tech and big consumer brands that they're using to drive engagement to build better attachment, better stickiness, and ultimately the mission that we both share is happier, healthier days for all patients.
So how do we do this? What are organizations doing? Michael, as you said, we were talking earlier about some of these strategies that we'll get to in a minute, but the key things are measuring what we're doing so that we can continue to get better. And that's focusing on those end results. And then making sure that the team is really operating to the full extent of their license. We hear this a lot, but making sure that the staff in the practice are doing the things they need to do to drive those good outcomes, as opposed to the administrative headaches that they're ill-equipped to handle. And so providing convenient experiences for patients to schedule these things and get that concierge-like experience navigating through that system is what really drives those results and allows for organizations to get creative, to think of things like, as Michael mentioned, the pop-up vaccine clinics or blood pressure check clinics or diabetes clinics or annual wellness visit clinics, to be able to really utilize the resources they have to reach a broader audience there, to overcome some of the capacity limitations that they have in their day-to-day activities. And so one of the things we've been talking about, Michael, if you want to share the HPV work.
Yeah, one of the things I think is so interesting is provider offices operate, for the most part, in the same way across the country, and there's not really a dynamic response for supply and demand. We've been running for 2 or 3 years a national initiative to get more patients vaccinated for HPV. HPV, for those who don't know, is the leading cause of oral, throat, rectal, and cervical cancer. And there are countries on our planet that have eradicated cervical cancer through widespread HPV vaccination programs. New Zealand, the UK. But here in the greatest economy in the world, we can't figure this out because we can't administer vaccines at great scale. I won't even start to talk about COVID because I promised to leave politics out of this presentation. But we've been going to our customers saying, we have funding, we will help you build multimodal patient outreach campaigns to get patients into your practice, to get them vaccinated for COVID, for HPV, for RSV, you name it. And the most common pushback we have is, I can't do that. I can't just schedule an appointment for a patient for a vaccine because the reimbursement methodology that we have in this country doesn't reward a provider for that activity in a way that covers their cost. And so what we then say is, well, that's fine. We'll send them to CVS. We'll send them to a Walgreens to get these vaccines. And more, not all the time, more and more we're hearing from providers, well, I don't want to do that either because now CVS has a primary care offering and I don't want to lose that patient to CVS. So what do? We work with HealthHelper to help identify what is the nexus of demand, and then HealthHelper works with providers to say, you've got a bunch of open slots on a Friday afternoon, turn them into a vaccine clinic, and let's bring 100 patients in to that practice so we can really deliver on what true population health and population management is. Population management isn't managing your attributed population in your Blue Cross contract. It's doing the right thing for the overall population. And if you do that, you should get paid for it.
Absolutely. And one of the keys to the success of those clinics is you're already allocating some of your staff resources to that. You don't want to then allocate them to the scheduling and filling of that clinic, but you want to make sure that clinic gets filled so that you're appropriately utilizing that resource. And that's where HealthHelper comes in to provide that concierge experience for patients, where we can look at the demand provided by Arcadia, match that with the supply, and do the outreach and scheduling to get those folks in so that you can perform well and provide the opportunities to have those touch points in between those annual visits to keep your patients engaged and maybe remind them that when they do get sick, their first call should be to their PCP and not to run to Minute Clinic.
I think one of the things that we were most excited about in our partnership with HealthHelper is being able to bring alive the data and the insights that we create. We work with over 100 million patients across the country, and we generate all these insights. But oftentimes we'll generate an insight that goes nowhere. I got a text message this morning from my car telling me that it needed an oil change. And in that text message was a link to schedule an oil change, and it took me 36 seconds to complete. I am overdue for an annual wellness visit, and I can't schedule online because my practice doesn't support online scheduling, so I have to call. They're only open between 9 and 4. They take a break for lunch between 1 and 2. I can never schedule this appointment. And that is the problem that we are collaborating to help solve, is bringing the same tools that major consumer brands are using to drive patient engagement and drive consumer engagement into healthcare to ultimately help improve the health of our communities. So I think it's a nice lead into how technology enables this. Our role in the HealthHelper partnership is to connect and draw those insights. One of the things that we help our customers with is to create a single person record to identify where there are opportunities to provide more comprehensive, more complete, more proactive care to ultimately extend health span. And HealthHelper is the last mile to ensure that when those insights are created, they're able to use technology to draw patients in and close those gaps so that providers are paid appropriately for the work that they're putting in, and also patients are getting the care they deserve.
Absolutely. And our work at HealthHelper goes beyond just the scheduling. It's creating those workflows off of those identifications and insights that Arcadia is developing, so that those workflows are established and can be run easily, not off the side of someone's desk twice a year when they get a few minutes to do it.
For more information about the partnership between HealthHelper and Arcadia, we're here all week in this booth. Jeff is HealthHelper's fearless growth leader. Yeah. Jake, Josh, and I are here to answer any questions, so please bend our ears. We're happy to help you solve this challenge together.
Yeah, very excited about this partnership, Michael. Thanks for the opportunity to speak in front of you all.
Thank you, guys.
Thanks.